Every fall, like clockwork, your television turns into a Medicare commercial. Celebrity after celebrity, smiling retirees, $0 premiums, free dental, free vision, free hearing aids. Call this number now. It looks incredible. And the people behind those commercials are spending billions of dollars every single year to make sure it looks that way. But here's the question nobody asks. Why? Why would a private insurance company spend billions of dollars advertising a product they claim costs you nothing? Where is the money coming from? And more importantly, who is it coming from? Because in business, there is no such thing as free. There is only who pays. And today we're going to show you exactly who is paying. And exactly what Medicare Advantage costs you that never shows up in those commercials. Stay with us, because this video might be the most important one we've ever made. Welcome back to Medicare Exposed. Every week, we pull back the curtain on the Medicare and Social Security decisions that cost retirees thousands of dollars every year. No commissions, no insurance plans to sell. If you're new here, subscribe right now, because what we're covering today affects every single person turning 65 in America. Let's get into it. First, let's understand what Medicare Advantage actually is, because most people don't fully grasp the mechanics. And the mechanics are everything. When you turn 65, you become eligible for Original Medicare. Parts A and B, the government program we covered in video 3. Now, instead of using Original Medicare directly, you have the option to hand your Medicare coverage over to a private insurance company. That private company receives a fixed monthly payment from the federal government to cover you. In 2024, that payment averaged around $1,000 to $1,200 per member per month. In exchange, that private company is supposed to provide you with at least the same coverage as Original Medicare. But here's where it gets interesting. Whatever that private company doesn't spend on your care, they keep as profit. Read that again. The less they spend covering your healthcare, the more money they make. That is the fundamental business model of Medicare Advantage. And once you understand that, everything else makes sense. The aggressive advertising makes sense. The $0 premiums make sense. The free dental and free vision make sense. Because none of those things cost the insurance company money in any meaningful way, compared to what they're collecting from the government to cover you. Now let's talk about what Medicare Advantage actually looks like once you're enrolled. Because the commercials show you the front door. They don't show you what happens once you're inside. The first thing you discover is the network. Medicare Advantage plans are network-based. HMOs and PPOs with specific lists of doctors, specialists, and hospitals. If your doctor is not in the network, you pay significantly more, or you pay everything out of pocket. If you need a specialist, you may need a referral first. If you travel or move to a different state, your plan may not cover you at all outside your service area. Original Medicare, by contrast, is accepted by virtually every doctor and hospital in the United States. No networks, no referrals required, no geographic restrictions. The second thing you discover is prior authorization. This is the one that genuinely shocks people. With Medicare Advantage, your insurance company has the right to review and approve, or deny, medical procedures before they happen. That knee replacement your doctor ordered, the insurance company can say no. That specialist your doctor referred you to, the insurance company can say you need to try a different treatment first. That hospital stay your doctor says you need, the insurance company can decide you're ready to go home early. This is not hypothetical. A 2022 federal report found that Medicare Advantage plans denied hundreds of thousands of prior authorization requests that would likely have been approved under Original Medicare. Hundreds of thousands of real people whose doctors said they needed care, and whose insurance company said no. Now pause here, because I want to be fair. Medicare Advantage is not a scam. For some people, in some situations, it genuinely is the right choice. If you are relatively healthy, if your doctors are in the network, if you live in one place and don't travel much, if the extra benefits, the dental, the vision, the gym membership, are things you'll actually use, Medicare Advantage can provide solid coverage at a very low monthly premium. The problem is not that Medicare Advantage exists. The problem is that it is sold to everyone, regardless of whether it's the right fit. Those TV commercials don't say, "This plan is great if you're healthy and stay local." This plan may cause serious problems if you develop cancer, heart disease, or need complex care. They just say, call this number. And millions of people do. Let's talk about the costs that don't show up in the commercials. $0 premium sounds incredible, and it is, until you actually use the plan. Because Medicare Advantage plans make their money on the back end, through copays, co-insurance, prior authorization denials, and out-of-pocket maximums. In 2024, the maximum out-of-pocket limit for Medicare Advantage plans was $8,850 for in-network care. That means in a single year, if you get seriously ill, you could owe nearly $9,000 out of pocket, on top of whatever you're still paying for Part B. And unlike original Medicare with a Medigap supplement, where your out-of-pocket exposure is clearly defined and capped, Medicare Advantage out-of-pocket costs can hit you in ways that are much harder to predict or plan for. Now let's talk about the decision you can't take back, because this is the part that really matters. Switching from original Medicare to Medicare Advantage is relatively easy, but switching back from Medicare Advantage to original Medicare with a Medigap supplement can be almost impossible. Here's why. When you first turn 65 and enroll in Medicare, you have guaranteed issue rights for Medigap supplemental insurance. That means insurance companies cannot deny you coverage or charge you more based on your health. But if you've been on Medicare Advantage for a few years, and you decide you want to switch back to original Medicare with a Medigap policy, in most states, Medigap insurers can medically underwrite you. They can look at your health history. And if you've developed any significant conditions during your time on Medicare Advantage, they can deny your Medigap application entirely, or charge you premiums so high the coverage becomes unaffordable. This is the trap. People enroll in Medicare Advantage at 65 because it looks great on paper. Then at 72 or 75, when they actually need serious medical care, they realize their plan isn't working the way they thought. They try to switch back to original Medicare with Medigap, and they can't, because now they have health conditions that make them uninsurable in the Medigap market. They are locked in, not because they made a careless decision, but because nobody told them this could happen when they signed up. So what should you actually do with all of this information? Here is your framework for making this decision the right way. Step 1. Before you choose any Medicare path, list every doctor you currently see, every specialist, every hospital you prefer. Then go to the Medicare Plan Finder at medicare.gov and check whether those providers are in network for any Advantage plan you're considering. If your doctors aren't in the network, the plan is not for you. Full stop. Step 2. Think honestly about your health. If you are managing chronic conditions, heart disease, diabetes, cancer history, kidney disease, the prior authorization requirements and network restrictions of Medicare Advantage may create serious barriers to getting the care you need. Original Medicare's freedom to see any provider anywhere in the country has a dollar value that doesn't show up in a premium comparison. Step 3. If you are leaning toward original Medicare, enroll in a Medigap supplement at 65 during your guaranteed issue window. Do not wait, because waiting means risking your ability to get Medigap coverage at all. Step 4. Talk to a SHIP counselor. Free, unbiased, no commission. Go to shiphelp.org. These are federally funded advisors who have no financial interest in what you choose. They will sit with you and look at your specific situation, your doctors, your health, your budget, your location, and help you make the decision that actually fits your life, not the decision that makes the insurance company the most money. The Medicare Advantage versus Medigap decision is the single most consequential financial choice most people make when they turn 65. It affects what you pay every month. It affects what doctors you can see. It affects what care you can access when you really need it, and it can be extremely difficult to reverse once you've made it. The television commercials will keep running, Joe Namath will keep smiling, and the insurance companies will keep collecting their government payments. But now, you know how the machine works, and that knowledge is worth more than any $0 premium. Hit subscribe and turn on notifications. Next week we're going deep on Medigap, the supplement plans that cover what original Medicare leaves behind. and how to choose the right one without overpaying. We'll see you there.